Well, all month long, we have talked about the weeks to month-long wait times for children to see a mental health professional right here in our area. But the group Kids Minds Matter is working to lower that wait, but they're calling on you to help here.
And joining us this morning is the Vice President of Government Relations with Lee Health, Michael Nashif. Thank you so much for being here on this Mental Health Monday. First of all, if we don't change things, will this shortage get worse?
Thank you for asking. And thank you for having me.
Of course.
The shortage will persist until we do more to address it. And I'd like to say that our leaders are working hard to address it, both at the health system here locally and with the federal and state governments. But as we're working to address that problem, there's an understanding that Florida is growing and that we need to do everything we can to keep allocating resources and giving families and the pediatric population the resources they need to get help.
And so, a lot of people moving here, we're seeing those growing pains.
And when we look at the numbers, what does this tell you?
So to highlight some of those numbers, we've talked about that roughly 100 providers for every 100,000 people in Southwest Florida, which is below the national average, about half of it, where there's a little bit more than 200 providers per 100,000 people. The age-adjusted suicide rate here in Southwest Florida is a little bit higher than it is nationally, about 14.8 suicides for every 100,000 compared to the 13.9 for every 100,000 nationally. So we know we have some work to do. But again, I do want to highlight that this has been an issue that the Lee Health Board of Directors, the medical clinicians at Lee Health have been working hard to address along with our community providers. And it's worth noting that the state legislature and the First Lady have been putting resources into this. Resources are a start. It takes time for those things to play out, and we know help is needed now, not down the road today.
And so what other issues, Michael, are you working on specifically? As we're getting the system figured out, what kind of issues can you help change now?
So it starts really, there's an old quote that I really like. All great change in America happens around the dinner table. That's actually attributed to Ronald Reagan. That's a way of saying strong families make a big difference. And we all have different access points, and our families all look a little bit different, and that's okay. So we're here to make sure that we address those issues by doing some tangible things along with strong families that are being invested in. We're looking at things like getting innovative. So telehealth. Telehealth has been a big help for creating access and strengthening the shortage of providers that can reach people. And so with the telehealth flexibilities that were achieved after the public health emergency through advocacy, we also have prescribing authority that was achieved with those changes, and we're looking for things like a mobile telehealth unit, Lee Health is, to implement to bring further out into the community access to individuals who need it most.
Yeah, get there. Briefly, because we're running out of time, what's one place somebody can go if they want to be part of the change?
KidsMindsMatter.com. We have a really easy access point for you all to write your legislators to get involved, and we're making it as cut and dry as possible. We want you to access. We want your help so that we can get this message to legislators.
Michael, thank you so much. Takes all of us, doesn't it?
Yes, it does.
We appreciate it.